So, as a follow up to my last video on what is internal medicine, I just wanted to talk about House MD. House is a great show about the adventures of a monster truck loving Sherlock XB and the homoerotic relationship he explores with his oncologist bestie. But it is also a terrible representation of inpatient hospital medicine, so here's how my job is different from a TV show. To recap, I'm a hospitalist, the primary doctor assigned to a hospitalized patient. I'm the shot caller of the medical team responsible for diagnosing and treating their acute care conditions, coordinating procedures or surgeries with the specialists I bring on board, and piloting the patient's hospital stay from admission to discharge. A lot of people are unfamiliar with how hospital inpatient medicine is different from clinic outpatient medicine, so I usually explain it like I'm kind of like House, with a few differences. Number one, where are your patients, man? It's probably narratively much easier to follow, but House only gets to be responsible for one patient each episode, which usually lasts like a few days. In real life, your average hospitalist is carrying somewhere from 18 to 24 patients at a time, with new admissions coming in and discharges going out on the daily. It's even a major plot point in season 1 where Vogler is looking at the hospital finance things and he's like, hey, what the hell is this whole department bleeding money? Is this even a real thing? And he grills Cuddy for letting House have a made-up Department of Diagnostic Medicine just because he's so smart.
What is a Department of Diagnostic Medicine?
That's Dr. House's department. They deal with cases that other doctors can't figure out.
It's financial black hole. Costs us $3 million a year. Treat one patient a week.
I get it, man. I think having an entire department dedicated to treating one patient a week is crazy too. Number 2, name a single non-doctor on this show. Like, do any of the nurses even get named? And also, where are the social workers throughout the entire hospital? Probably the most important people I have to answer to are the case managers who are assigned to each patient in the hospital. They're the ones who navigate the patient's insurance and set up the delivery of their oxygen tanks, wheelchairs, or home infusions. I literally cannot discharge patients from the hospital until the social worker actually gives me the green light, or else I get on and guilt tripped for almost causing a lawsuit for an unsafe discharge. Hospital medicine has so many moving parts, and just because doctors are off doing their own thing and saving lives and blah blah blah, you literally do not get anywhere unless your case manager is in the loop and literally taking care of the whole hospitalization outside of the medicine. Number 3, who gave you perms? House's team is under diagnostic medicine. Apparently, they're also credentialed to do all of their own surgeries, biopsies, imaging, breaking into people's houses, etc.
I'm sure it looked easier on YouTube.
In real practice, all of these jobs are specialized and done by different services. A surgery is done by a consulting surgeon. A CT is done by an imaging technician. A transthoracic echocardiogram is done by an ultrasound tech. A transesophageal echo is done by a cardiologist. In general, every specialization has their role, and medicine's is to figure out the patient's why. Also, modern hospital practices have practically eliminated the hospitalist's responsibility to do procedures. At the hospital I did residency in, we had plenty of experience doing paras or central lines, and we had a minimum procedure requirement for graduation. Now that I'm an attending at a bigger city hospital, we have an entire team of nurse practitioners and physician assistants whose sole jobs are to place advanced access, do thoracenteses, get LPs, etc. Back in the day, this was internal medicine bread and butter. But I guess from like a hospital's perspective, it's more cost effective to train APPs to do these procedures instead and then keep the doctors focused on seeing patients. Because I guess in the time it would take me to do a 30-minute para on one patient, I could admit 2 patients from the emergency department and start billing for their care. Whatever. There's a pretty good Conan Liu video about this and how resident procedure education has suffered a lot because of recent ABIM changes, but basically everything has just become streamlined towards the diagnostics. And as a hospitalist, my job is a lot more like a detective than the crime scene crew. I'm here to interpret results in the context of the diagnostic picture rather than physically obtaining them, or figuring out what should be the correct treatment rather than actually administering it. There are so many times in the show when the doctors are shown drawing their own labs or pushing their own meds instead of the nurses.
36 Vicodin.
Who's the patient?
I am.
And I'm just like, what the f? I don't even know how to start a drip on an Alaris pump. I've literally never started a bag on a pump before. Number 4, why does everyone do everything? Okay, so in the show's lore, House is dual boarded in infectious disease and nephrology, both 2 to 3 year fellowships that come after a completion of a 3-year internal medicine residency, and 2 of them. But he also did a 4-year pathology residency for some reason, but basically practices as a clinical internist, plus handles inpatient and outpatient outpatient duties every episode? Obviously, Wilson is an oncologist. The show mentions that Cuddy is an endocrinologist and Foreman is a neurologist. But like, without looking at the House Wiki, can you even name what residencies or fellowships other characters like Chase, Cameron, or even Amber are? Like, Cameron's an immunologist, Amber is interventional radiology, and Chase has apparently done a 3-year internal medicine residency, 3-year cardiology fellowship, and a 2-year critical care fellowship, and also did a year of neurosurgery in Australia, and he's supposed to be like 30? I don't think their specialties ever come up outside a few suggested differentials in the initial stages of an episode, and so they're usually wrong, and like maybe a procedure or two. In real life, all of these specialties would be on separate teams and individually consulted or brought on as the hospitalist to teams if necessary. Or if they were easy cases with a simple surgical fix, they would just be admitted by those individual services, and maybe a hospitalist would be brought on as an internal medicine consultant to manage their medical issues. Number 5, why are you even trainees anyway? So like, Princeton Plainsboro Teaching Hospital is a teaching hospital, right? You'd think they would have residents, right? Like, as far as the medical hierarchy goes, you have the medical student who is doing a rotation in the specialty, season 7 masters, the resident who is matched into the specialty and is learning how to practice independently, season 8 Dr. Park, the fellow who's graduated residency and is certified for general practice, but is continuing training in order to subspecialize in that field, and the attending, me, who leads the team and has the final say. Except in House, you realize that House is the attending, and all the people who work underneath him in completely unrelated fields are his fellows? Like, they're willingly sitting in there as trainees working hours and not getting paid great money just because House is some amazing doctor to train under? It's a big plot point in season 4 when Taub joins the team and his wife points out too, like, bro, if you were in private practice, plastic surgery, literally clearing like $800,000 a year, why the would you go back to a teaching hospital to be a diagnostic medicine fellow? Like, even if you're attending with some omniscient, biblically accurate angel who could teach you everything about life and the universe itself, and like, what the hell, half of these characters are literally fellowship trained already and older than 30. Can you afford to be doing this? All right, to the writer's credit, depicting everything like the above would probably make for some really boring TV. And as far as medical accuracy goes, House isn't really terrible, but a lot of the eureka moments that are made right before the final diagnosis are sometimes super obvious buzzword level associations that like any preclinical medical student could figure out. Season 5, episode 21, the Sporothrix episode.
You have a garden.
No, we live in an apartment. 3 weeks ago, our anniversary. I bought you flowers. I brought them home, and you were gone.
Roses? You have sporotrichosis.
If you want a better representation of inpatient medicine, Scrubs is still the most accurate show in my opinion. The Resident is also pretty good too. If you want more depressing realism than workplace vibes, then I definitely encourage you to check out The Pit. But also, it's about an emergency department and emergency medicine, and I don't touch downstairs medicine at all because those doctors are freaks.